your question hasn't been answered, please submit your questions in the chat or by email, and we will work to get you a response in writing. We will begin in just a few moments after we grant recording permissions.
Recording in progress.
Okay, I believe all our permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we will hand it over to you now to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Well, the start of school and the college and high school football seasons signals that fall and cooler weather are right around the corner. It's a time when all of us will likely begin spending more of our time indoors, where, of course, there's more opportunity for respiratory illnesses like flu and COVID-19 to be spread from one to another. Fortunately, in Ohio, we are still seeing around 25,000 COVID-19 cases a week. And the data shows that most of those people are no longer getting seriously ill. So that's the good news. Despite seeing a large number of cases, most of the people are not getting seriously ill. Hospitalizations have remained low and are not posing an overwhelming burden on our healthcare system, as we used to see routinely with COVID waves, particularly with overall numbers like we're currently seeing. In fact, only about 5% of our hospital beds and intensive care unit beds are currently being occupied by COVID-19 patients. Thankfully, our deaths too remain comparatively very low. Nevertheless, we continue to lose lives to COVID-19. Indeed, while we're no longer recording daily deaths in the hundreds, sadly, we still lose around a dozen lives to this illness in Ohio every day. And because COVID-19 is still spreading nationally as well as globally, and new variants are almost a certainty, we really cannot let our guard down. This virus has shown a robust ability to mutate, and variant strains have driven our last two surges in Ohio, both Delta and Omicron. Also, COVID-19 isn't the only virus of concern that we run into, especially in the cooler months. For the past two winters, influenza levels have been remarkably low here in Ohio, likely in part because we were socially distancing and wearing masks in response to what was a novel pandemic. Now, though, with much of our everyday life looking more like we remember it, and so many of us gathering again in schools, at recreational facilities and businesses, the chance for the flu to make a big comeback is very real, much as, in fact, we've already seen in Australia and much of the rest of the world's southern hemisphere. For that reason, I would highly recommend fall flu shots and encourage everyone to stay up to date with their COVID-19 vaccine series. This is particularly important for Ohioans who are most vulnerable, including those ages 60 and older, and those with significant underlying health conditions. Now, staying up to date on any vaccine booster series is important. And what it means is getting a booster shot when it's available and appropriate. And that's what I want to focus on in some more detail now, particularly in relation to the COVID-19 vaccine. In Ohio, more than 68% of adults have in fact completed their primary vaccine series of 2 shots. That's good news. That's about 6.2 million people. Of those, though, only about 3.6 million have received the 3rd dose or booster dose. That leaves 2.6 million Ohio adults who've not taken advantage of that next important step of getting a booster. And data has shown us that getting a booster can be crucial in terms of building long-lasting immunity. And now our booster shot has been updated to help your immune system recognize both the original or ancestral strain of the virus, as well as the recent Omicron subvariants BA4 and BA5. 2 familiar manufacturers have had their updated boosters approved. The updated Pfizer booster was approved for those ages 12 and older, while the updated Moderna booster is for those ages 18 and older. And as you'll recall, these 2 vaccines are extremely similar in terms of their chemical makeup. In both cases, the boosters can be given at least 2 months after completion of your primary vaccine series, or 2 months after a previous booster dose. These updated shots are a booster dose only. They're not part of the primary vaccine series, which still begins with the vaccine so many of us have already received. In anticipation of the arrival of these new fall boosters, Ohio providers were given the opportunity to pre-order these updated boosters in late August, and the first shipments arrived in the state almost as soon as they'd been approved. That means that if you're ready to get your fall booster, they're already available through many providers. And we'd encourage you to contact your provider, your local health department, or a pharmacy to check out the availability there. Now, who needs them? The fall boosters are in fact approved for those 12 and older, provided there's been at least 2 months since your last COVID-19 shot. But the people for whom the updated fall booster should be a particularly high priority are, of course, those more at risk for developing severe illness or dying from COVID-19. Now, as I mentioned earlier, that includes those who are immunocompromised, those who have a variety of underlying medical conditions, or those who are age 60 or older. Indeed, while COVID-19 hospitalizations and deaths are now generally lower in Ohio than earlier in the year, our older residents remain, as I noted previously, at the greatest risk of developing severe illness. 1 year ago, in September of 2021, 52% of the state's COVID deaths were among those aged 70 and older. In August of this year, so last month, 77% of Ohio deaths were among that age group, 70 and older. Also, recent CDC national data have shown that even with so many having recovered from past infection, if you are still an unvaccinated adult, you remain 4.6 times more likely to be hospitalized with COVID than if you were vaccinated and boosted. But if you're 65 and older and unvaccinated, those numbers are worse. You're 6.3 times more likely to be hospitalized than your vaccinated peer. Of course, we have long known that age is in fact one of the primary risk factors for developing severe COVID illness. And this data serves to underscore the importance of adding the latest booster to your vaccine series, especially if you're an elder Ohioan, and getting your primary series started if you remain any unvaccinated eligible Ohioan. So that covers some of the basics about this new booster and who should be seeking it out. And now I want to turn to our 2 guests today to talk about the importance of staying up to date on vaccinations, especially for our most vulnerable Ohioans. Dr. Anna Garanzi, Assistant Professor of Family and Community Medicine at the University of Cincinnati, and the Geriatric Medicine Fellowship Director from the Christ Hospital, University of Cincinnati, as well as Dr. Latoya Smith,
I think when I'm talking to older adults, the main focus is that piece that you mentioned, that they are at risk for severe illness, hospitalization, or death, but kind of talking to them about it and framing it on their quality of life. We know that getting the COVID vaccine or the flu vaccine does not 100% protect you from getting those illnesses, but I'm trying to protect you from that severe illness that can cause long-term effects. We're seeing people that don't even get hospitalized, but get COVID or are in the bed for 2 weeks, and that can have profound effects on physically, mentally, and emotionally. And so we know that these vaccines can help with that. We know that there's been a lot of research now about these vaccines, and I know patients can get frustrated with the fact that now it seems like these things are happening, annually, but just kind of going into the conversation that variants of viruses change, and that's why they're updating these vaccines, but that it's more that quality of life piece, that no, you may know somebody that got a vaccine and still got the flu, but it's less likely that they were, severely ill or hospitalized, and try to framework it. And, if a patient really likes walking or being active with their grandchildren, that like a severe flu or COVID case could really prevent them from doing that.
Thank you, Dr. Smith. Dr. Garanzi, anything that you'd like to add?
Yeah, absolutely. I think Dr. Smith said it so well that it's easy to focus on the negative and the fear piece of what can happen with COVID, and it's very true. But also, quality of life and goals of care and just the value of your day-to-day life is so important for our older adults, especially when they've been disproportionately affected throughout this whole time. Dr. Smith and I have both been in the nursing homes during this time, and seeing the effects of isolation on our older adults. And that's just not, we see it very acutely in the nursing home, but that's also people that are at home and independent or in assisted living, being away from family members and being away from these activities, whether it's walking or exercising or getting together with friends to talk or to do these activities that are so important. Social isolation has been shown to increase the rates of depression, which I think we all think about, but even more so the physical effects. So it's actually, we've seen shorter life expectancy with social isolation, and things that we take for granted until you see it. A lot of our patients in the nursing home lost weight during COVID just because family members couldn't be there to share a meal, or we were isolating them to keep them safe. But that also meant that you didn't have that communal meal. And I certainly know I love having meals with friends and family and not by myself. And this is the same for our older adults. So this is a really effective way to prevent that isolation. And I'll say that for, I think it's important to note too, older adults don't live in isolation. We all live in a community. We're so aware of this. So those of us that have loved ones that are at risk, whether that's immunocompromised or other reasons for being high risk, we also need to make the choice to protect our loved ones by considering the vaccinations for ourselves also, so that we could be the ones that visit and take our loved ones out to the zoo on a beautiful day like this, or all the things that we value in our lives. We're in a phase where some people are getting back to normal and some people don't yet have that opportunity, which creates just more of an ongoing inequity that we've seen throughout this time. And also we think about too, and I know a lot of people are ready to travel again. I know I am. So there's just the day-to-day inconveniences of having exposure to COVID, the COVID testing, all these kind of things. This vaccine can help to prevent that. As Dr. Smith said, we're most concerned about preventing severe illnesses with the vaccines, and we're seeing that they're highly effective from that standpoint. But if you also want to avoid the inconvenience of rescheduling a trip yet again, this is a great way to do it. And again, time off of work, all these things that we think about with having exposures to COVID that could be decreased as well.
Yeah, Dr. Granzi, you mentioned that in fact there are some other risk factors in addition to age that are a particular concern for physicians as we think about the population at risk. Could you highlight a little bit more about what some of those medical situations, those medical conditions are?
Absolutely. Yes. Thank you. So one that we think about is this bucket of immunocompromised. And I think that is one that not everyone is familiar with. So we often think about cancer patients, which is certainly true. But there's also a large group of autoimmune diseases, rheumatologic diseases. We often see these commercials on the evening TV for things like psoriatic arthritis, rheumatoid arthritis, kidney transplantations, or anybody that's had a transplant. People like that, which I actually fall into that bucket myself, that we have medications that make us more at risk from viruses that can be pretty minor to other people. That includes both the flu and COVID, certainly. But those are conditions that the medicines that keep us safe and functioning and healthy also make us more at risk for disease. And this is particularly important right now as we are in a time where mask mandates have gone away for the most part, that we have to modify our own behaviors so that we can be safe. And that's really challenging and puts us in a big, in a challenging situation. Also, that immunocompromised group is far larger than I think a lot of people realize when you consider how many people are in that group. Ed Young from The Atlantic has done some amazing storytelling around the stories of people and children included that are immunocompromised and how families are having to adapt to go back to school or the decisions we're having to make day to day. So that's one large group, is the immunocompromised. I will call out too that our group has different recommendations. So we are absolutely in the highest need to get the new bivalent COVID vaccine. I just got mine on Friday and I can't tell you how excited I was. And shout out to our local CVS in Walnut Hills that had it ready to go on Friday. I got the flu shot at the same time so that I could get a little boost, one in each arm. And, but you know, that's thinking about the other factors that come with that. So along with the for the immunocompromised group, the CDC has a whole separate page now. So you can go on there to get your recommendations about how our timing is different. The other risk factors are people with asthma and any underlying lung disease. We've seen that complicate certainly the flu. That has always been the case, but now we see this with COVID as well. We have still seen increased risk for people who have higher weights, have obesity. That one's kind of changed over time, but it still puts you at higher risk. And then I'll just want to say too, something that's really important to Dr. Smith and I both is racial health equity. And we have seen that, you know, in Cincinnati where we are, we have a 10-year difference life expectancy in many parts of the city between Black and white populations. And that has played out in COVID as well. So I will say our Black populations are a more increased risk, as well as Hispanic populations and a lot of minority groups. So thinking about that group getting protected is really important as well. Yeah, I'll stop there. Dr. Smith, do you have anything to add?
No, I think you covered the big groups. I think the most important thing is if you have a primary care doctor, kind of having that discussion of if you don't feel like you fall in that high risk group, or if you are concerned that this vaccine is not appropriate for you, but the majority of the population on the vaccine, this booster is appropriate for them.
Well, thank you both very, very much. I want to finish on the same note that I started with today. We're really fortunate here in Ohio and nationally that while COVID-19 still can be disruptive to our everyday life, fewer of us are in fact contracting serious illness. The data clearly shows that much of the credit for that goes to how many of us have been vaccinated. So it's imperative, particularly for our more senior Ohioans and others at higher risk, as described by my colleagues, that we remain vigilant, including getting vaccinated and boosted. And remember, your healthcare providers including professionals like Drs. Garanci and Smith, are a great resource for any questions that you might have. So with that, thank you. And Ken, I think we could open up to questions.
Okay, thank you, Dr. Vanderhoff. Our first question today is from Spencer Hickey with the Hannah News Service.
Thank you. You mentioned this in terms of older adults somewhat, but I believe that was Dr. Smith. But could you talk about the prevalence of long COVID and its effects for people of all ages?
Sure, I'll be happy to begin with that. It's increasingly clear that long COVID is a very, very real condition. We are still, however, learning more about it and still in the process of getting a better handle on how many people are in fact suffering from long COVID. But one thing is increasingly clear, and that is protecting yourself from severe illness from COVID-19 with a vaccine is clearly your best and safest way of protecting yourself from the development of long COVID, as well as some other COVID-related conditions. My colleagues, Dr. Garanci, Dr. Smith, anything that you might add to that?
Yeah, I definitely agree. I worked in a clinic that saw patients with long COVID, and it is hard because this is new to both the patients and the health care profession. So a lot of times we would have to talk about different things we could try, but we're still kind of gathering the evidence. But there is some early research out there that was showing that, you know, getting the vaccine does help in some of the patients that had long COVID. If they had not gotten the vaccine, we actually recommended that they got the vaccine, just because there's some early data saying that may help with some of their long COVID symptoms. But long COVID is definitely real, and we're trying to provide all the support and help for those patients, but it can be a difficult thing to deal with.
Mm-hmm. Yeah, and I think it's something we're following very closely in geriatrics, even not just for our patients, but it's going to be interesting and challenging to follow over these next few years, because we're basically creating a whole new group that may have long-term disabilities. So what is it? And we definitely know there's been neurological components of COVID. A lot of people have experienced like that idea of brain fog and the cognitive impairment that comes with that. We don't know what that's going to look like 10 years from now. Certainly, we are seeing the importance of inflammation around things like dementia and other brain disorders. So it would make a lot of logical and physiological sense that we may see ongoing cognitive impairment, or those people being more at risk for cognitive impairment in the future. So it's something we're watching very closely, even with our 40 and 50-year-olds. You know, what is this going to mean for the field of geriatrics 10 to 20 years from now?
Our next question comes from Jonathan Jackson with NBC4.
Doctors, thank you so much for taking the time today. I just wanted to ask, a lot of our viewers have had questions and concerns, even with this updated booster, that this might now become a yearly thing, almost similar to a flu shot. And it's kind of a two-parter. COVID fatigue right now is kind of hitting a lot of people hard, especially for those who've already been vaccinated and boosted. What would you say to those who are going through that right now, and also the possibility of this becoming a yearly thing?
Yeah, so I'll start again. I understand that concern, but a couple of considerations for people. First, the most important thing is for us to look at where we are right now and think about what the best options are right now for our health. And so you hear what we've talked about today in terms of our recommendations, particularly for those who are at greatest risk regarding this updated vaccine. Now, could this be a situation like the flu where we are recommending annual booster doses? Maybe, but that requires us to gather more data and have more experience in dealing with this illness. There is an encouraging scientific finding that we're watching very, very closely, and that is that In addition to the immunity that you get from antibodies, which doctors call humoral immunity, it's increasingly clear that our vaccines have done a very good job of stimulating a long-lasting form of immunity called cellular immunity, where a variety of immune cells in your body, which tend to have very strong, very good memory that can last decades, do seem to be activated and retaining their ability to respond. What remains for us to understand is how durable is that immunity, and how durable is it particularly for those whose immune systems may not be functioning at their peak at this time. And we'll learn more, and we'll have better guidance and advice to be able to offer as we learn more. But I don't think that the recommendation this fall for an updated booster is a cause for people to feel that we're not making progress. Quite the opposite. I think it's a clear indication that we are making very, very good progress in keeping people safe from this illness. Doctors, anything that you might add, or additional thoughts?
Yeah, I would add, I really think this is a time to celebrate. I kind of laughed that I was so excited to get the vaccine, but it's true. We are really getting to, for those that may not be as familiar, the flu vaccine has been trivalent, which means 3 different strains of a virus for a long period of time. And now we finally have a COVID vaccine that is more closely representing what is circulating in our area. So if we all know about the spike proteins by now, but this bivalent vaccine has the Omicron BA4 and BA5 spike proteins, which yes, the virus continues to evolve, but it's at least closer to where we are as far as Omicron. So now we're able to get a vaccine that's targeting what's actually happening. So I agree with staying in the moment of being like, this is going to be a big change. Up until this point, we've been working off the strain that we had from the very beginning in 2020. So we have come a long way, and in the scheme of things, it has moved quickly. I know I've certainly been waiting, but this has moved very quickly, and it's reassuring in that standpoint. And I would just say, that's actually the goal, is for this coronavirus to become like the common cold coronavirus that we are used to. And that, yes, that may mean that we need a yearly vaccine, but it means that it's controlled. It becomes more of a nuisance or something to avoid than a deadly disease. We were just saying before this, there's still 12 Ohioans dying every day from COVID. It's not a small number. And again, saying that you do not always know by looking at someone who's at risk. You don't know who you're potentially infecting that may not be able to recover, or maybe the person that's more at risk for severe illness and hospitalization and even death. So I'm with you, the COVID fatigue is real. We see it a lot, but realizing too, a lot of people that got boosted, I was already 9 months out from my last booster. So I think realizing that a lot of people are more than 6 months out. So it's reasonable to need another vaccine at this time.
Okay, our next question comes from Joe Ingles with Ohio Public Radio and Television.
Thank you for taking my question. My question is, as we, go into fall, going indoors more, around more people, a lot of people who've had the vaccine in the booster in the spring are questioning whether to go ahead and get it now and maybe, not have it extend through the winter, or whether to wait a month or two and so that it's fresh for the holidays. What's the thought on that?
Yeah, that's an excellent question. And one of the things that I think I'd point out to people is that the vaccine that we get for the flu is different than the vaccine that we get for COVID-19, because the viruses are different. And so you've heard us talk in the past about the timing of the flu shot being very important. And we do work to be very strategic about when we give that, because we know it will last for a certain window. The immune system reacts very different to COVID-19 than to the flu, as well as to the vaccine than to the flu vaccine. And we don't have those same concerns when it comes to dealing with getting your COVID-19 booster. This is something that if you're eligible and you're wanting to get that shot completed, go ahead, go out and get the shot, because it will still have that same beneficial impact on your immune system that we're looking for as you get into the depths of winter, that it will have in the shorter term. Because remember, we're not with this vaccine looking at just the bump in your antibody levels, which do occur over a shorter window, but this is a reinforcing of your body's cellular immunity, that much longer lasting immunity. And unfortunately, when we're dealing with the flu shot, we don't really have that same cellular immunity impact that we enjoy when we're talking about this COVID-19 booster. So I would not hesitate to go out and get your COVID-19 booster at this time. Colleagues, anything I left out?
I think for one thing, the recommendation is for those of you that have had boosters recently, it's 2 months after the last dose from completing your most recent booster or completing the primary series if you were completing that. One of the questions that might come up along that too is about infections, and that's a little harder to know. If you've had a recent COVID infection, most likely you can wait 3 to 6 months, but that's not yet fully known. I would say for those trying to strategize around holidays or trips, keep in mind you need 2 weeks from the vaccine to be more protected. I'm not going to say fully protected because, as we were saying, that full protection comes over more time, but you need at least 2 weeks. So if you're going to be strategic, include those 2 weeks at least, and ideally even 3 weeks if you can plan for that. So I think for those people that are kind of in that lower risk group, you can think about that, but I agree if it's available to you in your community, it's a great time to get it.
Okay, our final question today comes from Titus Wu, USA Today Network's Ohio Bureau.
Hi, Dr. Vanderhoff. Thank you for doing this. My question is, not related to COVID, but, I just wanted to see if there's kind of any general update on, kind of the status of, monkeypox in Ohio and how the monkeypox vaccines have been rolling out. So on CDC that, there was a small increase in the number of cases. So just wondering, just curious about like just a general update on that. Thanks.
Yeah, thank you for that question, because I think that we have some very, very good news, both looking at the data here in Ohio as well as the data nationally. And that is that we're seeing the pace of monkeypox cases slow demonstrably. As we look at the regions of the state, in northern Ohio, we've seen a slowing. In central Ohio, we've seen not only a leveling off, but actually some decline. That's very, very evident. And it's almost certainly because of the wonderful work that has gone on at a community level, driven by many of our local public health departments to get the Jynneos vaccine out and into arms. In fact, we're now, in terms of vaccine, at a place where there are areas of the state where our supply is actually outpacing the demand for the shot. And the Department of Health, the Ohio Department of Health, can now deliver the Jynneos vaccine to any local health jurisdiction that requests it, and we can get it there within 1 business day. Now, despite that progress, it's clear, though, that there are still many people eligible for the vaccine who haven't received it. So we are certainly not relaxing our efforts at all. But some encouraging news that we're seeing, and of course, the other encouraging factor has been that hospitalization rates remain very, very low, and there have been no deaths in Ohio.
Okay, thank you again for joining us. Dr. Vanderhoff, do you have any closing remarks?
Well, my thanks again to my colleagues, Drs. Garanci and Smith, who joined us today, as well as for members of the press for your continued attention and messaging around these important health issues for the people of Ohio. And I would again encourage people, especially those at the greatest risk, to get out and get both your flu and COVID-19 boosters as we head into the fall. Thank you.
This concludes today's press conference. Thank you.